Hello everyone, I'm Dr.Parinaaz Parhar, Clinical Head at Oasis Fertility, Secunderabad. And today I will be talking about secondary infertility. Now, what do you mean by secondary infertility? Secondary infertility defines a condition where a patient has had a pregnancy in the past but is finding it difficult to conceive again. It is a condition which is very confusing for patients. They find it very difficult to believe that we conceived so easily the first time, so why are we facing so much of difficulty the second time? It's not something uncommon. We see a lot of patients in the OPD who come to us because they are having difficulty in conceiving the second time. Now, the reasons, one of the most common reasons for secondary infertility is contributed by the age of the mother. As is commonly seen, that usually because nowadays parents are preferring to have a gap between the first and the second child. So when they start planning the second child, usually what we see is that the age of the mother has increased by the time they want their second child, and also in some cases, unexpectedly, the reserve of the mother might have also reduced. So resulting in a decrease in the number and the quality of the eggs. So this is one of the most common factors why patients have difficulty conceiving the second time. Another reason which might contribute to secondary infertility is that at times, after 1 or 2 conceptions, a patient might end up putting a lot of weight, which might unmask a previously underlying condition like polycystic ovarian syndrome. Because of the sudden weight gain, a lot of ladies present with irregular cycles. And once your cycles become irregular, they make it difficult for you to conceive. So that can be another reason why you might have difficulty in conceiving. Some patients also present to us with a desire to conceive after they have had a sterilization procedure. We have a lot of couples where they have undergone a tubectomy in order to prevent any future pregnancies, and then because of a lot of unforeseen situations in their life, they want to have another child. Now, these patients usually have 2 options before them, where they might, based on the numerous factors like the husband's semen parameters and the wife's age and reserve, we might have the option of reversing the infertility either by doing a tubal surgery, or the patients might also need IVF in order to help them conceive. Another tubal factor which might be responsible for secondary infertility is if the patient has had some infection in the past which has led to the blocking of the tubes, making it impossible to conceive again. Secondary infertility is also called if you have had an ectopic pregnancy in the past. So an ectopic pregnancy is where you've had a pregnancy in the tube. So in these patients, it might have resulted in the removal or the non-functioning of at least one of the tubes. So these patients also present to us with difficulty in conceiving. Another common cause of secondary infertility is where a patient might develop some uterine problems like a fibroid or a polyp. Now these are conditions where you have a mass growing in the uterine cavity, and it basically acts like a space-occupying lesion which is interfering with the implantation of the embryo and leads to patient having difficulty in conceiving. Another factor which might contribute is if you have had some adhesions after any abortion or any excessive bleeding in your previous pregnancy. Usually the management of such heavy bleeding or an abortion might involve excessive curettage, where a lot of scraping of the endometrium might have been done, resulting in subsequent adhesions. Patients with this condition usually present with decreased blood flow following such events. So these patients also might have difficulty in conceiving again. Also, we have patients with endometriosis. Usually with age, conditions such as endometriosis, adenomyosis might tend to aggravate. And again, they might cause difficulty in conceiving because of their impact not only on the uterus, but also on the ovarian reserve because of the endometriotic cyst which might be formed. Another common cause which we're seeing very commonly nowadays because of the increasing trends of cesarean section is something called as an isthmosene. Now, what is an isthmosene? Isthmosene is where you have a defect at your previous cesarean scar. So these patients usually present to us with complaints of some brownish discharge either before their bleeding starts or after their menses, and they usually have fluid or blood collecting in the uterine cavity because this is basically collecting at the site of their previous scar defect, and this might be responsible for secondary infertility. So if you're someone who has had no problem conceiving in the past, but now you have been trying for over 1 year and you don't really understand that what is the reason for this failure in conceiving, please feel free to contact your infertility specialist. Last but not the least, let us not forget the male factor. Your husband might have had excellent semen parameters in the past, but it is quite possible that with time, because of various lifestyle factors or because of some addictions, his semen parameters might have gone down. So it's also very important to not forget the examination of the male partner if a couple is suffering from secondary infertility.